So where do you want to go for lunch today?
I don't care. What do you feel like?
Nah. The cafeteria kind of gives me the runs.
You know, it'll depend on Dr. Haus today, what he decides. How long he decides of keeping us here.
That's true.
Where is he, by the way?
I don't know. I saw him lipping his butt up here earlier.
Well, hello residents. I'm Dr. Haus. I have the misfortune of teaching you all about medicine. I would learn your names, but you actually are not worthy of being called by your names, so I will call you Dr. 1 and Dr. 2. Well, residents, y'all want to be real doctors. This is our patient. We have a 55-year-old male. He has a sudden change in bowel habits, persistent constipation, dark stool, positive for blood, severe cramping, and stomach pain. Some relief provided with OTC laxatives. What should we rule out first?
Could it be lupus?
It's not lupus. Try again. In fact, it's almost never lupus.
What about performing a colonoscopy to rule out colon cancer?
That's a very good idea, Dr. 2. We will give the patient some go lightly and we'll have a little look-see tomorrow. So what are you guys waiting for? You got a job to do, don't you? So what did we find?
Well, after doing the colonoscopy, we found several tumor masses inside the colon, which confirms our diagnosis of colon cancer.
Well, since this patient has metastatic colon cancer, we're going to have to treat this pretty aggressively, so we're going to have to go with surgery plus chemo. And for the chemo regimen, we're probably going to go with FOLFOX. What can y'all tell me about FOLFOX?
Well, one of the major factors we need to let the patient know is that they need to keep a positive attitude at all times to help with the treatment. And then the hardest part of the FOLFOX treatment is being able to tolerate the FOLFOX regimen itself, or treatment itself.
Well, that's a nice thing to tell a patient, but tell me, what do we need to know about FOLFOX?
Well, FOLFOX is a chemotherapy regimen used to treat colon cancer, as you just stated. It contains 3 medications within that regimen. It contains folinic acid, oxaliplatin, and 5-fluorouracil. And the regimen is also given in cycles. On day 1, the patient is going to receive folinic acid and oxaliplatin infused over 2 hours, followed by 5-fluorouracil for 22 hours. On day 2, the patient is going to receive folinic acid alone for 2 hours, followed by 22-hour infusion of 5-fluorouracil. And then on day 3 through 14, the patient's not going to receive any therapy, but then restart the cycle again on day 15.
Dr. 2, how many rounds of chemotherapy will this patient need?
Well, it all depends on each patient's response to treatment. Normally, you would generally go up to a 12 cycle to fully eradicate the cancer. Treatment generally depends on each patient's response rate. You can go up to 12 cycles.
Dr. 1, why are so many cycles necessary?
Well, cancer is very difficult to get rid of, and in this initial stage of this cancer, we need to treat it very aggressively.
Dr. 1, what major side effects with folinic acid should the patient be wary of?
Folinic acid side effects include rash, wheezing, and it could possibly increase the platelet count, which may require an anticoagulation medication to be brought on board.
Dr. 2, tell me about oxaliplatin and fluorouracil.
For fluorouracil, that could possibly suppress the patient's immune functions of their bone marrow. It could also cause diarrhea, as well as sores in their mouth. To prevent the sores in their mouth, we could have the patient suck on ice before treatment and 30 minutes after their treatment. There's another thing that could possibly arise called hand and foot syndrome, which is a painful swelling of the palms and their feet. Therefore, we could encourage the patient to wear loose-fitting clothes and moisten their skin at all times. For the oxaliplatin, that could possibly cause numbness and tingling of their hands and feet. Some patients are unable to tolerate cold drinks, and they also might have difficulty swallowing. Another side effects with oxaliplatin is hearing loss and temporary damage to their kidneys.
Good points, both of you. What other considerations should we be aware of? Dr. One.
Well, the patient needs to be aware that they're going to be experiencing nausea and fatigue. And since they will have probably diarrhea, it is important to ensure that the patient has adequate fluid intake to compensate for the dehydration that they may experience. And since they're at an increased risk of infection, they may need to be aware that if they have a fever greater than 100.5, that they need to contact their doctor as soon as possible, because an infection needs to be treated aggressively due to the problems that it could cause while being on FOLFOX.
Do you have anything to add, Dr. Two?
Well, we need to let the patient know if they do experience any redness or discomfort around their PICC line. They will need to contact their doctor or visit their nearest emergency department. We also need to counsel the patient on using their mouthwash to prevent any possibility of ulcers arising or future infections. Patients need to be aware of the possibility of hair loss with a FOLFOX treatment and the inability to have children in the future.
Dr. One, Dr. Two, I'm pleased with what both of you have done today. If you continue to impress me, you may earn the right to be called by your names. If you keep working this hard, you might just save a life or two.
This has been an educational piece on the FOLFOX chemotherapy regimen. We hope you found this entertaining, educational, and useful for if you ever have to encounter any treatment on FOLFOX or for colorectal cancer. This was brought to you by students at Harding University College of Pharmacy.